Let's talk about positioning when breast or chest feeding your baby. Hi, I'm Sophie and I'm a neonatal nurse at Serenity Neonatal Clinic. Now, one of the key things when feeding your baby is making sure that the positioning and attachment is optimal to ensure milk transfer and that it is comfortable and sustainable for both you and your baby. There are numerous positions that you can feed in and you can choose the one that works best for you. Some of the more common ones that you see will be the cradle and cross cradle hold, the rugby ball technique. You might see people reclining and feeding their baby lying back. People might feed in bed, side lying, or when the baby gets older, they might use the koala hold. All of these may have their place in different stages of your feeding journey. But what we want to do when we are feeding our baby is ensure that we follow a few set principles. So the first thing we want to do is when we've got our baby ready for a feed is hold our baby close. We want to make sure that they are tucked in nicely, bum tucked in, tummy tucked in close to you. Make sure those arms are free, so one maybe down here and one up there, and in this position again, one here and one tucked up there out of the way. If you are using a cushion to support the baby while you're feeding, because maybe you've had a C-section or you just find it more comfortable, again, that is absolutely fine, but just make sure baby can get close to you. So once we've got baby tucked in nice and close, we want to make sure that their head is free. So when a baby is feeding, they tilt their head back so that they can get a nice deep latch. If we are holding baby's head, they will not be able to do this. Therefore, you can use the C shape to support baby, whether it be this position or one of the other positions, but that they should still be able to tilt their head back to feed. The other thing we want to make sure is that baby is all in line and that they are not twisted. A baby with a twisted head and neck is unable to get a sustainable deep latch. So just make sure that they are in a nice straight line. Once we've got our baby close with head free and in line, it's time to make sure that the nipple is in the correct position in regards to where the baby is. So we want to aim for our nipple to be pointing towards baby's nose. This ensures that when the baby tilts their head back and opens their mouth and comes forward, that they get a nice deep latch with the nose pointing towards the top of the back of the mouth, which is what is the optimal position for feeding. So we make sure we've got nose to nipple. Once we've got all of those correct and baby's got a nice latch and is feeding beautifully, it is time to make sure it is sustainable. Therefore, make sure you've got a drink to hand, your favourite chocolate, and a good series on the telly to binge.